Welcome to the new flash of decoding healthcare research. Today, we will talk about fructose in the context of artificial sweeteners. I found this paper published in May 2024 in the European Journal of Endocrinology by Dr. Chen and his associates. They both are in the Netherlands and in Australia. The title of the paper is Fructose Intake from Sugar-Sweetened Beverages is associated with a greater risk of hyperandrogenism in women, a UK Biobank cohort study. So the background for this study is that the consumption of fructose has been associated with multiple metabolic changes at the level of the liver. The most important one is the lipogenesis and storage of lipids, not only in the liver, but peripherally. This same group had performed several studies before, and they demonstrated that as a result of the alteration in the lipid synthesis, there is also a decrease in the synthesis of globulin of the globulin that transports sex hormones. So this globulin is important to maintain the normal levels of testosterone. So the hypothesis here is that fructose in sweetened beverages is associated with a decreased level of sex hormone binding globulin, and also with an increase in the levels of testosterone. To test this hypothesis, they used the UK Biobank cohort study to try to analyze, based on the different types of fructose intake, if there is a clear association between this fructose and the risk of hyperandrogenism. What they found was that in the sugar-sweetened beverages with fructose, especially above a level of 10 grams per day, the levels of the sex hormone globulin is decreased, and so the levels of testosterone is also increased. This elevates the risk of hyperandrogenism in women in 2%. Because there is a potential confounder of BMI, given that those who consume high fructose in their diets usually are obese, it's possible that that confounder explains the results. That's why they did an additional Mendelian randomization study in which they analyzed a variant in one of the genes that codes for a protein that is important in the metabolism of fructose. What they found was that patients with this variant exhibited normal levels of sex hormone binding globulin and testosterone. What is the conclusion? That the changes in the endocrine profile associated with testosterone is due to fructose, not necessarily fructose in the fruits, because when you correct for the amount of fiber, these results normalize. So the conclusion is that sugar-sweetened beverages with fructose are associated with an increased risk of hyperandrogenism in women, quantified as 2%. This has clinical implications in terms of not only the hormonal profile, but the risk of even infertility, acne, polycystic ovary syndrome, something to explore further in additional research. And I think this information is important, and the recommendation is especially for women to stop taking sugar sweetened beverages. I hope this information is useful. See you in the next episode.